Welcome to the Empowerment Zone with Ramona Houston, where we zone in on Black and Brown relations and our journey to empowering our communities.
Hello, welcome to my podcast. We have Dr. Brian Gosa with us today, and I'm so happy to have Dr. Gosa with us. He is a clinical pharmacist at the Wellstar Cobb Hospital, heart failure clinic here in Georgia, and he's been working as a pharmacist in various places for the past few years. I'm really happy to have him as an educated African-American man with a doctorate, a terminal degree, as well as a person who's excelled in the STEM field, science, technology, engineering and math, STEM. And I'm happy to also have him because of all that is going on right now in our country and world with COVID and the violence against Black people and brown people, and just talking about some real issues that are facing our communities. Welcome, Brian. How are you doing today, Dr. Gosa?
Doing great, Ramona. Thank you for having me. It's truly a pleasure. You've been talking about it and you made it happen. So I'm just honored to be a part of this collection of podcasts you're putting together.
Yes, I'm really excited. As you know, this podcast is really focused on highlighting the work, the passions, the people and the organizations in the African-American and Latino communities, but also really addressing some of the issues that we face and moving toward empowerment of our communities. So we'd like you to speak to that, but tell us about yourself and your work as a pharmacist and just your life experiences and what type of advice you would have to our audiences in some of the health issues that we're dealing with, and you can just go from there.
Got you. Well, my name is Brian Gosa. I'm a native of Selma, Alabama, historic Selma, Alabama. Born and raised, so a lot of what we're talking about, empowerment and, standing up for what's right, that's been ingrained in me for a long time, coming from where I come from. As you say, I'm practicing as a clinical pharmacist. So I did my schooling at Auburn University in Auburn, Alabama. I got my doctorate of pharmacy there. And after that, worked at various places, did a little work retail-wise, CVS, hospital, Vaughan Regional Hospital in Selma, and then moved from there to working with the VA health system. Spent about 10 years working with veterans and their families, doing medication management, with chronic disease states like diabetes, hypertension, a lot of the things that affect our community from a chronic disease standpoint. And currently I'm working, as you said in the introduction, with the heart failure clinic. So we're working with a population of patients, low-income patients we see a lot of, and people who are dealing with the heart failure, which is a disease state that oftentimes goes underlooked, undertreated, undermanaged. And so in this clinic, we're providing an increased access to those patients to get what they need. We do a lot of medication assistance in situations where patients can't afford medications, working through different channels to help them access medications and things like that. So a lot of my life has been centered around helping the community through healthcare. My mom was a pharmacist, so I saw a lot of the impact that she had on the community, how respected she was because of being willing to go the extra mile and bridging the gap. In our community, there is a big gap. We call health disparities in our community. Some of the biggest reasons for that, like I said a few minutes ago, is income, healthcare costs. No matter where you are, healthcare costs. Even if you have insurance, it still costs. So that's cost as far as your doctor's visits, if you have to go to the ER, medication-wise. So that's a gap in itself. Another big one is education, and not necessarily just formal education, book reading, but education on your body and health and what it means to be healthy and what that looks like. A lot of what we do and have been accustomed to When we talk about diet and exercise, is different than what we should actually be doing. So being educated in those things. And what I found is once people are educated and they know how to connect the dots, they usually have better responses. And that leads into the next thing, as far as the providers that we have. You know, as a Black and brown person, it's not rare to go into an office and your doctor not look anything like you, not speak the language that you speak. So there's a communication breakdown. So if there's a communication breakdown, it's hard for them to educate you on, you know, what your needs are, or to be sensitive to your situation, and to even care. We have seen situations to where providers, because of whatever biases that they have, they just don't care about the patients, and that affects the amount of treatment that they give. So what all of that is to say is that I've been blessed to be positioned in a place to where, you know, knowing that all I have known growing up socially and then being able to merge that with what I've learned academically in this healthcare profession, I can be that person to bridge those gaps, to really bring some empathy to the table and to help people, you know, feel that someone cares and they earn that trust, and then to be able to get them to where they ultimately need to be. So that's kind of the spiel how I got here and what I kind of see my role evolve into, and, you know, the position that I take pride in being that person to do that.
So when you talk about health disparities, I find it very interesting about the lack of education on the part of many people, particularly Black and browns, on health and health issues. And you say you help them to connect the dots. Mm-hmm. So what kind of information do the Black and brown communities usually lack in terms of health? What are you teaching them about that our audiences can take that information to better their own individual health as well as the health of their families and their communities?
Right. So you got to start with just understanding what it is that you're dealing with. So if you got diabetes, you need to understand what diabetes is from the standpoint of what's going on in your body. You know, understanding that our bodies want to be in a normal state. We have all these organs and things that are working together. But when we get sick, there's a breakdown somewhere. So first, we need to understand where the breakdown is, why it happens, and is what's happening related to something that we're doing. So I'll lead to diabetes, one of the most prevalent in our communities. It's high blood sugar, right? And usually that high blood sugar is related to us overworking our system too much to the point where it can't keep up. And we do that. We overwork our system by what we eat, right? So we want to eat to live, but, you know, just based off of the way that we grow up, like, you know, I've seen that many of my family members have dealt with diabetes, but you always can connect it, most times, I say not always, but most times can connect it to what we're eating, all right? And our meals are high carbohydrate or high sugar meals, and it's what we've always been accustomed to. That's the potatoes, that's the macaroni and cheese. I always have to have bread with my meal. That's the fried foods, right? And we always do it in large portions. What many times is left out is that you can eat certain foods, but it becomes a problem when you eat too much of the certain foods, right? And in our society, our portion size, what we're used to is much more than what we should actually be eating. So to answer that question is just a matter of knowing what the disease state is, and then being able to know what we're doing that may be contributing to it. That's the first gap. And then if you move into the second thing where my expertise is the medications, is understanding that the medications are not a cure-all, right? Some people expect to get on medicines. Well, I'm going to just get on this medicine and I'm going to take this medicine, but I'm going to still do whatever it is that I want to do, and the medicine will balance it out. But it really doesn't work like that. The medicine is really just an assistance to you doing certain things. So I need to be watching what I eat. I need to be exercising. And then I also need to be taking the medicine and allow those things to work together and get away from the thought of, well, I can just take the medicine and it'll be fine. And because what ultimately happens is the medicine doesn't work, or like that. The doctor will continue to increase your doses. He would continue to add more medicine, and then you have another line of problems because of drug interactions and things like that. So I would just say is understanding the disease state, and then also understanding, what your role is to help you better manage. And you have to kind of take control of that and not depend on the doctor and the medications to fix it for you.
Those are two great pieces of advice. Is we have to understand the disease or the challenge, the health challenge that we have in order to deal with the causes. And then also understanding that medication is only there to be assistance. It's not there to be your cure. You have to cure yourself as you take the medicine. So when you talk about the disease state, how can Black and brown people avoid getting to the disease state? How can we what are some tools and tactics we need to use to address the underlying causes that creates disease?
And we put this into perspective because there are some disease states that are, hereditary or inherent, those things that, you may not be able to do anything against. But even in those, there are things that you can do as far as supportive care to maybe minimize symptoms and to prolong life. But a lot of what affects us as African Americans, Black and brown people included, are what we call modifiable disease states. And those are disease states that you can actively prevent from what we find in the studies. And so that's the heart disease, right? So that's heart attacks and strokes. That's the diabetes, as we talked about, high cholesterol, things like that. And so with those, one of the things that we really push for is preventative care. All right, preventative care, things that you can do that will lower your risk of having these things. And most of them are the main two culprits are diet and exercise, right? Watching what you eat. So that goes everything from what we talked about with carbohydrates, as well as to processed foods, and even some meats. And what I've seen in my time of practice is that, a lot of the foods that are on the shelves that are easy to make, that are easy to prepare, have all of these other things in it, that really make for this hodgepodge of bad stuff. And, it could be things like soup. I have a lot of patients that like to eat soup, even the vegetable soup. And they say, well, soup is a good alternative. It's better than me eating fried chicken. But in that soup, because it's been on the shelf, it has a lot of salt in it. Right. And that salt is going to lead to high blood pressure. All these other preservatives that are doing, we don't know what to our bodies. So we really have to be, cautious about, our diet. So getting as much education on the foods that you're eating. And they're ready, on the internet, your doctor's office, whatever, information is readily available to kind of guide you on what you should be eating and how much of it you should have. And physical activity. And that's everything from, running marathons, going out jogging, doing all of that, to just walking to your mailbox or walking down the block and back, something. And what we're trying to do is we're trying to keep our bodies in balance. We don't want to have, be loaded down so much with food and then we're not balancing it out with the physical activity. We always want to kind of create that balance in some form or fashion. And those are really kind of the two big things as far as what you actively can do to kind of prevent those disease states, in addition to just educating yourself, researching certain things, talking to your doctors if you have them about, other things that you can do to go along with that.
Thank you for that advice. So we really got to go to the basics, which is diet and exercise and understanding food. I mean, it's the basics. I mean, a lot of us are always looking for this quick, easy pill, but it is easy. Diet and exercise.
It is. It's lifestyle though. It's lifestyle modification, and you really don't necessarily have immediate gratification. There is no immediate gratification on eating more salad than fried chicken if you've been accustomed to eating fried chicken, and everybody in your family eats it. And if you go to the family gathering, you might be seen as a strange person if you're not eating what everybody else is eating. Okay, so it's not easy. So it's a lifestyle modification, but it's a decision that you make for this long-term goal that you're trying to get to. Like I run, I'm a runner. I run marathons and 5Ks, but I get to certain points where it's hard for me to even run. But if I'm going to do this, then I have to put in that work each and every day to get to that point. Because if you don't put in the work, you're going to stay at ground zero, and you'll find yourself stuck at ground zero for a long time.
Yeah, I appreciate you emphasizing lifestyle. I know when our family is we eat very, very healthy. When my brother died, it caused a lot of stress for us, even though we were healthy before then. And we found out, we discovered that foods would trigger certain emotional responses, health responses. So we became even more healthy, even though we were already healthy eaters. But when you talk about lifestyle and going to family reunions and going to funerals and just going to family activities, our family discovered that, we had to start bringing our food with us, because we would go to a family meal and it wouldn't be one vegetable on the whole big old line of buffet with the family. It would be not one vegetable. Right. And so we finally discovered, hey, we're going to have to bring food with us no matter who's hosting it, because we don't eat like that. So it is a lifestyle change that, as you stated, sometimes it may feel a little uncomfortable in the family because you're a little different. I mean, my family always makes fun of us saying, or me in particular, oh, you don't do nothing but eat grass. You know what I mean? So, but that's what you do to remain healthy.
Yeah. And I guess on the flip side of that too, that also speaks to another issue, when you talk about this empowerment picture, is within our community, we have to get to a point of embracing a certain amount of open-mindedness to things that are different than our traditions, right? A lot of times we are getting caught in these traditional ways, some good and some not so good, especially in our families. And so we're held to these traditions that may ultimately be holding us back. So I would say to your listeners to always stay in a mind of being open-minded and innovative and empathetic to what's going on around you. Now, just because you want to do this certain kind of way, that doesn't really give you space to diminish and downplay someone else in what they decide to do. You may actually be able to learn from that if you're open-minded, and it make better for a situation. So we also have to do in this time, with all that's going on around us in society, and we're talking about these different things, but we need to really take a look at empowerment. And what can we do to create this environment that is conducive to us growing and not being stuck solely in tradition.
That's good. Great advice. I want to ask you something about what you talked about earlier in terms of the health of Black and Brown communities, is this whole provider issue, and how, there are communication challenges, and also sometimes when we have doctors who are outside of our communities, there may not be a biggest commitment to our care. From a communication standpoint, we know that a lot of Black and Latino men do not necessarily want to be cared for by women, right? Or someone, as you said, that the whole communication piece, you have to be culturally competent as a doctor to serve various communities. But anyway, I want you to expand a little bit about that, because a lot of people don't have an option in the community. I'm from a rural area. We didn't have Black doctors in my town. Do you see what I'm saying? So everybody doesn't have an option to be with a doctor who is of their culture. You see, right. Or so can you expand on what people need to do in order to what advice would you give with people who are seeking care and doctors that may or may not, that's not to say that all doctors in your culture are great, but just they cannot go to someone within their culture or within their ethnic group that would understand them culturally?
And that is one of the downsides. And you said it, being in a rural area where you don't have choices makes it that much harder. And I come from a place very similar to that. So in situations like that, this is where, let's just say it is a rural area, and you may have to travel 50 miles to have another selection of who you want to see. This is where community comes in, right? If community is aware of the fact, and it goes around, who the doctors are, especially if you're in a small community, who the doctors are. So if you don't have any good doctors, the community as a whole should rally around. And we've seen this. Communities rally around, and then they make sure people can get to those providers, because you have to go. Even in the situation in Atlanta, we're kind of spread out here. You may have gone to a doctor in the city, and that doctor wasn't any good. Mm-hmm. So you may have to travel to Gwinnett. Mm-hmm. So you got to go. So I think the biggest thing is knowing that and not being afraid to do something different, right? And then the community rally around, or family members rally around and say, we're going to do whatever we need to do to get you to the place that's going to give you the best care. A lot of times we get kind of intimidated by the system, get intimidated by providers. The doctor is who the doctor is. Whatever he says goes. And it doesn't necessarily work like that in all cases. You always have to be willing to get a second opinion, like you did. Ask many questions when you go into the room. Empower yourself. You don't like a provider, get your family members to rally around you. Find a provider and go there. And that's just kind of where it is, because if you don't, you sell yourself short and you're just settling for whoever it is just because they're close. And that's not really fair to you to do that.
Well, Dr. Gosa, we're already out of time, and this is a great interview, and we didn't even get to everything we wanted to get to. So I would definitely like to have you back sometime soon. Thank you so much for educating our audiences on healthcare and how we can take better care of ourselves individually, collectively, and as a community. This was great advice in how we can change our lifestyles to make sure that we remain healthy, especially in this time.
Oh, for sure. I enjoyed this. Yeah, the time got by really fast, but yeah, I look forward to doing this again. A lot more to talk about.
Thank you, Dr. Gosa.
Thank you.
A special thank you to the incredible team of the Empowerment Zone. Terry Gully, theme song. NADWorks, digital support, and of course, our featured guest.